Hi, this is Edie, publisher of Waterfront Life, and I have with me someone today that is just a respected man in this area, besides a lot of philanthropic and community involvement. He is really good at what he does. So say hello and introduce
Hello there. Hi, how you doing today?
Go ahead and tell us who you are and what you do.
Okay. Hi, I'm Bryan Bergens. I'm a periodontist, which is a dentist that specializes in periodontal surgery, gum grafts, implants, basically in-office surgery of all types. And that's what I do all day.
And go ahead and give us your background. Tell us kind of what led you to get into this field, and then a little bit, about your education and ongoing education.
Yeah, when I was going to college, I wanted to go in the medical field, but I wanted to work with my hands a lot. And I love working hand skills to building things and doing procedures or things like that. So I decided dental school was a good field for me, since I can have relationships with patients and work with my hands and help people who need help. So that's how I got into the dental field. I really like the science, the surgery, and working with my hands.
Okay, well, I've gotten to know you well enough that I know you're a humble guy. If it was your wife, she would have a lot of things to brag about. But tell us a little bit about where you went to school and some of the ongoing training or teaching that you're involved with.
Right. I went to LSU Dental School and did my residency there. And then I moved up to Portland, Oregon, and practiced, and I taught at the dental school there. I was associate professor in the dental school there for about 15 years before we moved to Florida. And right now, I am on staff at UF and the dental school in the graduate department for teaching residents, dentists that are training to be specialists, and that's what I do kind of part-time. I am board certified, and I'm boarded in implant surgery as well as periodontist. And so my practice is a full range of practice. I use even lasers, different type of surgical procedures, and correction of all kind of implant problems and things like that. So I'm heavily involved in a wide span of procedures, but that's what I do. And of course, I keep up with a lot of CE courses and a lot of training of the students.
Excellent. And well, just because it's this time of our lives, go ahead and talk a little bit about how you and your office has dealt with COVID and what you're doing in an ongoing basis.
Yeah, it has changed the office protocol a lot in all dental offices. I must say that we were extremely up to date, and most dentists are, when it comes to protection of themselves and the staff versus the patients. Most of us was saliva and blood transmission we were concerned about. Now we have COVID, which is aerosol. So things in the office, of course, I'm doing the temperature screenings and separating patients, and waiting room has chairs separated, and we have air filtration systems in every operatory, high-speed suctions in every operatory. I'm getting more and more vacuum type equipment as they can make it and come in at this point here. That is kind of the key. The key is keep aerosation down, and of course we have all the masks and gloves and everything else, and hand sanitizers for patients. And and as we separate the patients, that also helps keep cross-contamination down from patients if we separate them out so much. So we're way up to date with that. We have UVC sterilization, ultraviolet light sterilizations, and HEPA filters, like I said, in the operatories, is sucked to vacuum out turns over the air in the room, and things like that. So it's a lot. It's a lot more besides just our normal PPE protection that we're doing now. But I feel very confident everybody's very safe in the office. Yeah.
Yeah, absolutely. Well, like I said, I know that you're a humble guy, but what would you say separates you and your office from others in this type of practice?
Well, I continue heavy amount of training and education, along with teaching and learning the advanced skills of everything in the school, as well as helping students. I like to spend time to meet patients and talk to them and get to know what they need. I'm heavily involved in surgery, but I try to be as conservative as I can, which a lot of dentists and periodontists may not be so as conservative. I try to as best I can. And I think getting to know patients and understanding what they want and what I can give them the best way I can, that's the most predictable long term, I think is lost a lot in a lot of practitioners. They just want it quick in and out, and sometimes that's just not the answer. It's a long road to get to the end point. And so I think that helps me with 29 years of experience of practicing and teaching. That goes a long ways in helping understand what patients need and get to their individual goals.
Absolutely. And I will say I've been in your chair before, and I have firsthand experience that you really are conservative. You really think in the bigger picture of what is best in my situation, what was best for me. And so I can personally vouch. What would you say you enjoy most about your practice?
Talking to patients, helping patients. I think I like that the most there. That's what drives me from doing this so many years now. You would think you'd be burnt out, but on Monday I'm ready to get back to work. I enjoy what I do, and I enjoy the getting to help patients and getting the needs treated as they need to, and get them to a healthy environment. So I think that's what drives me, and that's what I like to do.
So I know you're from Louisiana, and I've seen your accent slip, although you would
Yes.
never know it in this interview. So tell us something about yourself that maybe the regular Daytona or patient might not know about you.
Well, I know how to crawfish. I know how to gig. I know how to gig for flounder. I've grown up in New Orleans, we did so much outdoor activities, so most people don't know how to maybe even boil crawfish the way we boil it in New Orleans and what we do. So that's one thing. I like road biking, so I like to get outdoors and ride in the parks and things. So I do a lot of road biking. I play tennis. I'm not that great, but I do play tennis. I enjoy that too. So I like to keep busy outside, and my wife and I like to travel, and so we try to go on trips and broaden the horizon on culture of different cultures that are out there in Europe and South America, North America. And so when we can travel, we like to travel and see far out areas and go to different countries and learn about their environment there. So that's kind of
excellent. So what would you say your advice to someone who might be someone that knows, because this isn't the most comfortable subject when you have a problem going on, but what would your advice be to potential clients or patients?
Yeah, well, this is a trying time right now with the COVID-19 virus and what's going on. But I would say do not be afraid to come in. Like I said, dental offices, we're the number one when it comes to protection of patients and how do we control disease spread in the office more than any other profession. So I would say come into the office. Let me look, let me see what's going on. If you procrastinate, a lot of times things get deteriorate to the point where there's a lot more procedures need to be done, a lot more expensive things need to be done than if you come in early when you know there's an issue and catch it beforehand. It makes it a lot less expensive, a lot less costly for patients, and a lot less surgery, a lot less treatment. So I know it's a scary time, and I certainly understand that. And I know they're saying, stay home as much as you can. But if there's an issue, procrastinating always leads to deterioration, and then especially in the dental world for the most part. And so, I know in our office we're doing everything, all the CDC, all the guidelines. We're protecting patients about as much as anybody can ever do, except shut down. And so, you have to be very comfortable coming in, because I'm there, so I know that I want to be comfortable there with patients. And so that would be something I would recommend to patients, or somebody that has an issue. It doesn't get better. They just get worse. And so delaying it is sometimes not the best answer.
Absolutely. So tell us how to find you.
Well, I do have a website called www.DaytonaBeachDentalImplants.com, or you Google my name, it'll come up for the website. I do have, my phone number is 386-258-2213 if you want to call the office. That would probably be the best ways to call the office, or just look at my website. They have all the information about me, about procedures, what we do, and about where the offices are. I do have some satellite offices, so my geography is spread. So, even if you don't live in Daytona, you live further out, I have an office in DeLand and Palm Coast. So that I rotate around and see patients. So that would be the easiest way there. Yeah.
Excellent. Well, Dr. Bergens, you've been an advertising partner with Waterfront Life for going on almost 7 years.
Oh.
I really want to thank you for being such a good partner, and for all your support all those years.
Very well.
And
it's been wonderful. It's been wonderful.
appreciate you and how good of a job you do as a doctor. So thank you.
Thank you. Thank you. Thank you.